I'm Dr. Chris Landon. We were approached about 4 years ago on a very basic question by the First Five. The objective of the First Five is really to get children ready for school. Regardless of their financial abilities of their parents, we need to have children who are school ready. So today, this is yet another conference. We really need to tie this all together. Our speakers today, Dr. Kundell. Dr. Kundell is a developmental pediatrician from Thousand Oaks. I think he gave one of the first funded lectures by the First Five, really introducing, and I think he'll recap a little bit today, what a very poor job we do. That when we take the Denver Developmental Screening test, we draw a line through the 18-month and go a little bit on either side. That just does a terrible job. It's a non-validated test. It's what we call GOBSAT or GOGSAT, which would be good old boys and good old girls sitting around a table and just coming up with what their experiences are. So what we've done is really introduce PEDS so that we take a respectful view that the parents have an idea really of how their children are developing, that when they go to the park, that when they go to the store, when they go to the market, that they're looking at all the children, they're looking at their cousins. And if they feel in their hearts that there's something different, they need to have permission to talk to you. So the PEDS, the P-E-D-S, we'll talk about briefly. We've used that as a screening tool. We've taught that to our family practice residents. We've taught that to our pediatricians. It's used in a number of our clinics as a secondary tool, and for us a primary tool because we take care of such developmentally at-risk families, families who are socially have difficulties, putting their children at risk, teen mothers putting their children at risk, infants of substance abusing mothers who become children of substance abusing mothers, children at risk. We use a second tool. And we have been cooperating with a project from Johns Hopkins, and we have an online tool. We see that electronic healthcare record is an important wave of the future. The hardest part, though, is that last inch. And so with help with funding from First Five, we have tried very hard to work out, and Dr. Lapellis is going to talk a little bit, how do you introduce this into your clinic? And what they did that was so brilliant is they sat down the receptionist. This is where it starts. It doesn't start with the doctor. The doctor is the least important, no disrespect to ourselves. So the who is really important. The janitor should really want your child, their children, all the children in their neighborhood. If they work at your clinic, they are the medical experts for the neighborhood, and they should be excited about developmental screening. Dr. Laura Mabey has joined us as well. She's our current president of California Chapter 2, and we'll talk a little bit about the EDSI project. I spend a lot of time as the director of pediatrics with people pulling on my beard and going, "Ooh, I'm going to do this better than you," and thank goodness they feel that enthusiasm. And so Dr. Bobrau attended the EDSI from our Los Islas clinic. Dr. Copa and Dr. DeAndrea have joined them. And this is really taking a look at how can we improve the quality of care in our clinics. And they've done an excellent job, and we hope to incorporate even more of that into our program here in Ventura County. Dr. Goldie, our pediatric neurologist, we truly, in this county and really for 3 counties, are the center of excellence. We provide access to a pediatric neurologist for people with Medi-Cal, insurance, regardless of their ability to pay, but also we have the Tri-Counties Regional Center. And with the Regional Center, this is not the final, oh my gosh, now I have to reach down into, this is the finest care, the finest screening that's available. We have very energized caseworkers who are providing access to care, support to parents who may be Mixteco, who may not have English or Spanish as a native language, and providing access to care throughout the county. As we surveyed our pediatricians and went to our family medical group practice, what we found is that the family medical group practice had, in the year 2009, had done 1 developmental screening. Now this is a group that's training 39 family medicine residents, and they had done 1 developmental screening because they weren't being paid. Thank goodness now through Medi-Cal and CHDP, you can be paid a reasonable amount of money. We are looking at a revolution, I guess, unless you guys have all written in by Monday or called, left your fax and messaged in, that all the children on healthy families will be moved to Medi-Cal. Here in this county, we have Medi-Cal managed care. What's going to happen in terms of payment for developmental screening? Are they still going to default to CHDP and allow us to have increased payment for this very important subject? Dr. Russell, who's one of our pediatricians and director of our maternal child health and adolescent program for the county, in other counties this has been the reward. They've taken the profits and said, you know what, if we start out right, if we start with developmental screening, this is how our children are going to have a future. And I need a future. All those 5 to 9-year-olds, as you see, are leaving us in Ventura County, and someone's going to have to care for me. So I really hope that we can provide them with proper development.
This should be the real title of the talk. In the past 10 years, I've seen real headway in the consistent use of standardized screening tools. As far as I'm concerned, the candle has definitely been lit. I don't think it's as arbitrary the way we approach developmental screening as Chris implied. I think there has definitely been real headway, and the headway has occurred in part because providers are reimbursing now for standardized tools. That really has had an effect. Developmental screening became important with the passage of the Individuals with Disabilities Education Improvement Act of 1990. This federal statute recognized the importance of early intervention in improving developmental outcome for high-risk and developmentally delayed infants and toddlers under 3 years of age. The act mandated statewide systems to address these needs and allowed the states to set up their own eligibility requirements. In California, these services are provided through the regional center system. The initial goal was to provide services to 2%, which is currently being exceeded.
Good morning, everyone. So here's my plug for the AAP. Our budget really got impacted this year. With membership, there was an invoice issue from National also, but for any of you who are members of National but not members of the chapter, I would highly encourage you to send in your dues because we really do need them. So I'm here to talk this morning about how my practice as part of the Early Developmental Screening Initiative, or EDSI program, which was funded by First 5 LA, adopted developmental screening in our office. I'm from that behemoth county to the south, so most of my data comes from LA County. But as our previous speaker was saying, lots and lots and lots of kids go unscreened, and we need to do a better job of getting kids ready for kindergarten entry. This is data, national data from 2007, and the only reason North Carolina is circled in green and doing so well is because one of the presenters for the EDSI program, Dr. Marion Earls, is in North Carolina. They have done a really excellent job of promoting developmental screening and spreading developmental screening, teaching how to do it to their pediatricians in the state of North Carolina. As you can see, they're doing much, much better than California. And another way of looking at that is looking at reading to young children. And again, other states are doing much better than California as far as early literacy. In LA County, over the last several years, mostly because of this big grant from First 5 LA, the EDSI project was begun. There was an initial pilot program in 2007. There was an LA County specific collaborative in 2008, 2009, and in 2010, we actually co-sponsored it with Chapter 4, which is Orange County, and had 25 or 30 practices spread through 5 counties in Southern California.